Hello, everyone. It's Phil Jacobus. It's the 17th of September. It's 4 o'clock in the afternoon. I'm here at my office in New York City, and I'm taking a vacation day tomorrow, so there will be no interview tomorrow. We're very lucky today because we have a very interesting person, Dr. Erin Jospe. I really enjoyed my interview with her, and I know that you will as well. She has a lot of insight, and I'm anxious to share that with you. But before I do, let's take a look at a couple of news stories on healthcare business news today. One story we see is that there is a national action plan has come up with a plan to reduce medical errors and improve patient safety. You know, some of this is, anyway, it's interesting. It's common sense. It's a worthwhile read. It's not a terribly long article, and I encourage you to read it. You know, another very interesting story is that Gilead Sciences has acquired Immunomedics for $21 billion this week, $21 billion this week. And Immunomedics has a very interesting, or a very exciting way of curing cancer. Gilead Sciences is devoting itself to cancer. Once I heard the president of that company speak, and he's instills confidence. So he's the new president there for a year. So I think you'll enjoy that article, and it talks about something. It's really an improvement for cancer treatment. And now, hello everyone, and welcome. And today we have very interesting guest, Dr. Erin Jospe, who is the Chief Medical Officer at Kairos. And Dr. Jospe, thanks so much for joining us.
Thank you so much for having me today.
Now, just for fun, I know that Kairos, it means, explain it to us again for our viewers.
Sure. It comes from the Greek root, much like chiral forms. So it has to do with the overlay of things that are mirror images. So we're all about making a match. In our case, we're about matching patients with providers. And so Kairos is a play on that word with its root in the nature of matching.
And when you say matching patients with providers, you do this digitally. Tell us, if you would, tell us just a little bit about Kairos and what it does.
Sure. So foundationally, our very mission is to enable human beings to take care of other human beings. And we believe that we can do that through connecting patients with the providers that will best meet their clinical need in the way that they would like that care to be delivered. So we are a provider data management company where we aggregate and dedupe information on providers for typically a health system that can then leverage that data to their patient and consumer communities so that they can find those providers that best meet their articulated clinical need. And we do so in a way that's very respectful of how providers wish to be discovered for what it is that they do best. And in that way, we hope that we respect both sides of that equation of what makes a really great match for patients and providers alike.
That has to include a lot of data analytics, I would guess.
It does indeed.
And you then, how does the patient interface or take advantage of the data?
Sure. So we work very closely with health systems to get all of that data together and to surface that through their digital front door. So typically through their web pages, and our data is then powering their find a provider or find a doctor service. So whether that's being done on that web page that a patient is directly interacting with, or it can be leveraged through an access center, or it can be leveraged even within a clinical setting like an emergency department or another provider's office to help the patient transition to that next level of care.
I see. Now, Uh, Unfortunately, we're all living through this horrible coronavirus period. Um, what are some things that, in some ways, that this has helped patients during the coronavirus? What are some of the top challenges that patients have faced, and how has this helped them?
So I think first and foremost, there is an imperative to keep people safe, both healthcare providers and patients. And one of the best ways we can do that is to make sure that the clinical setting, the brick and mortar of where clinical services are typically provided, is really reserved for those clinical needs that really must be done in that setting. And so what that enables is some creativity in thinking how we can bring care to patients where they are in their homes. So from a virtual care standpoint, this has really accelerated both patient understanding of it as a service offering, a delivery mechanism, and providers' embrace of it. I think there's just been a tremendous pivot that we've seen where health systems have gone from almost no appointments that were virtual in nature to now thousands and thousands of visits a week. And the acceptability of that, and in fact, the improved outcomes for certain areas of care has been really wonderful to see.
I take it there have been situations where patients uh, could address their issues without visiting the hospital.
That's right. So, well, ideally still, if someone has an emergency, they feel safe and welcomed into an emergency setting. But there's so much care that can be delivered really effectively in a delivery mechanism that's virtual in nature. So for example, mental health care and behavioral health care is really often very well suited to a digital experience, whether it's a telemedicine visit or a virtual care visit that's video in nature. There is a lot of chronic disease management as well, where not only can outreach be done from the provider's site to the patient to engage them, but the patients themselves can have better medication monitoring, can engage more effectively with more people within the care team to really have the close monitoring that many conditions warrant and are benefited by. So diabetes care, hypertension management, post-stroke care, all of those things are opportunities for a digital type visit. And I think we're going to continue to learn more. I think we need to do justice to those imperatives of keeping people safe, of doing what's clinically appropriate. But many wellness visits are primarily history taking in nature. Chronic disease management and medication management are really very history based. And likewise, mental health it's an engagement much like this, where there's not a physical laying on of hands that's as necessary as it is to just feel like you can have a connection with someone and continue to work through those issues. And we see that reflected in the types of searches that people are doing for care. So your earlier point about the importance of analytics in this, Kairos makes sure that we are looking at what it is that patients are searching for, and can they then find providers to meet those needs. And what we've seen is, despite COVID, people are continuing to look for management of their chronic illnesses like diabetes. It's one of the top searches that's done. Mental health and behavioral health issues, depression, anxiety, also very, very high at the top of the list. And women's health and obstetric care, which again happens to be a service line where much of the visit is really important to have a dialogue more than a physical laying on of hands.
Now, is this these searches that you're describing, they take place on the provider's website?
Yeah, so on the health system website, there's typically a find a provider experience that's part of their entire digital front door offering. And so it's a way for patients and consumers to engage with the health system. And there are so many different types of offerings and experiences that are digital. There's a lot of educational content on those pages. There's a lot of different types of searches that can be done. But one of the most important searches, I think, is the one of how can you research and find and match with a provider that's going to meet your clinical needs. So rather than know you need to see Dr. Jospe, you can do a search for hypertension, you can do a search for AFib, you can do a search for depression, anxiety, and find the right providers to help meet that clinical need and pursue your appointment that way. And Kairos furthermore can help facilitate that, not just the search and match, but then the scheduling, if that's another service that those health systems would like to offer, so that again, we can make sure that we're facilitating the conversion of that patient from a research exercise to a demonstrable appointment where they can get the care that they need.
Does Kairos help to create that search algorithm, search engine?
Yes. So what we do is we power that search and enable it with many different types of business rules, because again, that routing of patients to where you have capacity is going to be very important to make sure that that experience doesn't end in frustration. It's all well and good to find somebody that can take care of your anxiety, but if they don't have an appointment for 4 months, that isn't really going to help you. So to be able to understand what is available, where is their capacity? Do you want a patient that's doing a search for anxiety to find a primary care doctor, or do you want them to go directly to a psychopharmacologist or a psychologist? Those types of decisions can be made at that health system level, so that again, that search engine isn't just offering up people who can do it, but people who should be discovered for those things, because not only do they have the clinical competency, but they also have the availability to tend to that patient's needs.
Now, it must take some time to accumulate all of the data on all of the different practitioners and what they have to offer into your search engine or into your algorithm, whatever you call it. How long does that typically take in a health system? Is it something that can happen quickly, or is it months?
It is relatively quickly when you think about the types of data that can be aggregated that way. So again, we are aggregating numerous sources of data, everything from the credentialing system to the availability of that patient in their scheduling system, so their EHR, to different notes that might exist in the scheduler's head, to a binder, to a post-it note that's in their office, marketing data like photographs and professional statements, so many different sources. What's rather unique about our offering is that we deduplicate that data. So where I might be identified as Erin Jospe in one of those sources, and I might be ES Jospe in another, how do you know that that's the same person? So certainly making sure that that is the case, but we also give a voice to the provider. So we have a clinical taxonomy that's over 21,000 terms strong, that's both clinical language as well as lay language. It's available in Spanish as well, so that what we enable is a provider to have their, what we call their clinical keywords configured for what it is that they should be discovered for. So what is it that's really within their skill set, as well as what is it that their health system needs them to be discovered for, because they know that demand is out there. So it's really enabling providers to have a voice that personally I feel very passionately about. So as a clinician, I think we're often viewed as interchangeable. I think that kind of mindset contributes to provider burnout. And we're not interchangeable. There are things that make us unique. And while we can certainly fulfill clinical needs similarly when we have the same training, we all have things about us that make us different and will help to facilitate a relationship with a patient where that's going to be very important. And it also allows us to highlight where we may have true focus that's different from someone who may seemingly have the same credentials, for example. So it's that type of enrichment that I think is very different, appending that profile with that clinical language allows for, I think, clinicians to be seen in a way that's very different from a lot of health IT, where I think it oftentimes feels like something that's being done to providers instead of with them or for them.
And can I assume that you provide the health system with data or analytical data that they can use to tweak their offering?
Absolutely. So it would essentially be of limited use if it was just set it and forget it, because the health system's business cases, their needs are going to continue to evolve. Different service lines will be targeted for growth. New providers will join the system. So it needs to be flexible. And that's another area that I think truly distinguishes Kairos. You don't need to go through us. You don't need a support ticket. There's tooling that's there that allows a reflection of those business needs in an ongoing fashion, so that really you can be routing those patients to the providers that you want them to be discovering. It has to be flexible, or else it really becomes of eroding value. And again, our premise is to enable human beings to take care of human beings. That's not a one and done. What's necessary is going to continue to change.
Well, as a healthcare consumer, and having visited websites or my hospital website and my hospital interface, I really embrace this concept, and I see that finding someone new, I have ended up calling my primary care physician or sending him a little message through my, the hospital interface and saying, can you introduce me to a X? And so this is a good thing that you've done. So it sounds like it's a great idea.
Well, we hope that it's empowering for patients and providers, because, and I'm certainly an offender this way as well. We create little micro networks of providers that we know because we've worked with them for years. But the provider that we know might not be the best person for a patient. You have your own value system to decide what might be best for you in whatever next step in your care journey may be necessary. So do they take your insurance? Are they in a convenient location? Are they the gender that you would prefer? So a lot of times it's not just, does this person have clinical expertise to take care of me, but there are many, many facets that should be considered. And we hope that we can respect and surface whatever value system a patient might be bringing to bear to make that equation continue to work for them, and not just rely on who their provider might know. Not that those recommendations aren't without value as well, but we like to make sure that you can do your own searching.
Well, you're a very passionate and caring person, and I think what you're doing is a great service. So keep up the good work, and thank you very much for joining us today.
Thank you so much for having me. It was a pleasure.